First things first, I know that the clinic AMC has been mobilized as part of this cluster response, doc. So you guys are doing the testing. Can you tell us when, where, and who can come and get tested?
Um, to help public health and everyone else, we ask all the clinic to kind of get ready for people to come in and get tested. And also, when people come in and get tested, they just have to document where they get exposed to. So that way help public health in and kind of do the contact tracing. Anyone that being exposed to the basketball game, the A Lounge or Subaki Tower, they can come in, identify themselves, and we're going to do testing for them. For us, we're going to use the Abbott ID. Is basically is molecular test to try to confirm to screen them. The process have been there, and so we're going to stand up the process again for people to come in. Either they can call the appointment or they can drive through, and we would test them. So all the clinic hopefully been informed that they expect to have some surge of people coming in to try to get tested as much as possible.
Doc, how serious is this? I mean, serious enough to call a press conference when we look at the possible exposures. And we'll just start with the Subaki Tower thing. So they're saying April 14th to April 18th, anyone ate at the restaurants, and we're looking at 961 people possibly exposed was the language they used yesterday at their press conference. But does that possibly exposed meet the CDC definition of a close contact?
No, that's just precaution wise, and we really have to cast a very wide net just to make sure that we capture everyone. It does not meet the definition of close contact CDC, but again, you don't really know the situation, how much people have been exposed to. So it's very important for us to do is to kind of screen everybody that present during those time in the restaurant.
I was there was something in the comment here. Are these people infected with any of the new variants? And we can't tell that here on Guam, right? But I think what people are thinking, Doc, is that, for example, the basketball game, when you have
I
12
kind of
people,
lost you.
12 people playing, right? Then eight of them positive, 8 out of 12. That's crazy.
Yeah, it's just a lot. I tell you, the basketball game at home is really uh, there's no mask there, and it's very close contact. In the E lounge, definitely there's all the social distance and everything else. All the guidelines gone, so that's why it's so contagious. Again, it's all like I told everyone last week. It's all a personal responsibility. There's always going to have a basketball game. There's always going to have an event that you can sing or you can join your family or friends. Always, it's not the last one. So if you have any symptom, you just have to respect your friend, your colleague, and your community, and stay home and miss one event. It is not that big of a deal. We really do very good at this point. So we would like to continue to do the same thing, and you have to be responsible. The economy and everyone open. We, as a whole island, we do very well. So everyone deserves to be open, and the economy should be back. But again, we really ask for individual to be responsible for their action and think about not themselves but everyone around them.
We had a comment here, Doc, from Gina, who comments in maybe people are in great need to earn an income that they went to work despite being sick. I want to hear what the reason was for that employee going to work. So, Doc, with the Subaki Tower staff, were there any of them who were symptomatic that had gone to work?
They are symptomatic, and once you're symptomatic, you can spread it pretty easy. If you have young people, your symptom might be very mild. You just have some congestion, a little bit coughing. But again, no one know that little congestion, coughing can spread in the workplace, at home, as we've. So again, if you seek them, all the tests are everywhere now. All the clinics are do testing, a lot of rapid testing. It take about 10, 15 minutes to do. So if you want to go get checked first. In any clinic, it didn't cost anything. So just go get checked, make sure that you are negative. If you really want to go, then you can go, but get checked before you do anything.
What about the A-class lounge, Doc? Where do you know offhand if the protocols were all being followed? And I asked the same question to Chima. And if we are following these protocols, what does that say about the potential for the spread of the virus inside an atmosphere like Karaoke Bar?
Yeah, Chris, once you get to a situation like A-class lounge, when the mask gonna come off, people are singing and they drinking. So even if the establishment have all the guideline, everything together, but it's a individual responsibility and also the establishment responsibility to monitor those things, make sure that people, the customer are following the guideline. If it's not, again, you're going to impact a lot of people. When you do something like that, you can see you have 10, you got the virus, you bring it home, and now it's like it spread very fast. Again, it's a different way you can look at it. Okay? So we come to a point where a lot of people have been vaccinated. Okay, so you have somewhat protection out there in the community that the virus will not get to a point where our hospitalization going to be overwhelmed. We hope not, and that's not what not what we want. But again, we cannot prevent the virus from spreading. Okay, but if you get the symptoms, it's not going to be severe, but you don't want them to spread. So for us to move forward, there's two things. You got to get vaccinated. That's number one. And you got to be responsible. That's number two. And, we hopefully this incidence here, a lot of people pay attention to it. It's very good. So that way we kind of all learn about a mistake and to go forward. Hopefully we won't do that again.
How you feeling though, Doc, about this?
The good part about is that it's in the cluster. You know where it's coming from, and it's not widespread through the whole island. If you have case everywhere, no, up north, down south, central, everywhere that you cannot trace back to one source, then I would be very worried. Even if the number is lower, but you see throughout the community, everywhere on the island that yes, we cannot pinpoint. I would be very worried. This one is a cluster. Public health, just like Chima said, doing a wonderful job. I have to say they do a very good job and do the contact tracing and put the info out there for people to know. It's easy if people just if you are in those events, just go get tested. You know who you are, and help the whole island, help public health, help your friend, your community, and go get tested. So that way, you know that you're not infectious and you don't spread out the virus to somewhere else.
Doc,
So it's important that they jump ahead of time, and they really jumped this time very fast, and we really appreciate them for doing that.
yeah, it was definitely. Well, I mean, when they called a press conference and said that they were going to explain more about the recent positives, I think people didn't know. I thought they were going to say like, oh, and kind of unexplain it and say, oh, it's not a big deal. It's all connected to one group. But for them to come out and just give out all the information, I know at least a couple senators who were just really surprised and pleased that we got this information when we got it, which is, kind of as it happens. I mean, so much during the pandemic was after the fact. And I understand because, we're busy responding. We did have a couple comments here, Doc. D. Wayne writes in, can you explain no charge from the clinics? I just had a COVID test on Wednesday and I paid for mine.
I'm not sure how you pay for yours. If you come in and the only time that you get paid for the COVID test right now, if you do travel clearance, if you have to go somewhere off island for travel purposes, that's the only time that you get paid. You have to pay for it. But if you come in and say I'm in close contact, I'm sick, you should not be paying at all. I'm really surprised that those scenarios still there. You know, when if you come in and you have close contact or you have the cough and cold, you can come on anywhere. You shouldn't be paying at all. You know, I mean, those that person that put a comment, you know, call me, contact me. I really need to know because I really need to find out really why he or she is paying for it. The tests are free.
Doc, and I know you. I think you had covered this the other day. Would the doctor know? This is from Rosemary. Would the doctor know if the 4 patients in the hospital now were vaccinated?
All 4 patients in the hospital are unvaccinated. None of them have any vaccine at all, not even the first dose.
And then Dwayne comments back based on what you said, Doc. So what about to clear in for work if they have, like, let's say, for example, we're telling people if they're sick, stay home, but they have to
Yes,
work, so they need a test to clear to go to work. Is that free or is that something they get paid for?
that's free too, and that's where they come in, they talk to the provider, the provider get the history, and they should get tested, and it should be free. Now, there's a different scenario. If you go to a clinic that don't have the rapid testing, okay, and you have to do the PCR testing to be sent to either public health or DOS, especially to diagnostic lab, you might be charged for the lab from diagnostic lab if your insurance refuses to pay for it.
Mm.
So if I'm that person, no, find out the clinic have a quick test or not. Do they have a rapid testing? The rapid testing are all free. The only time you pay something if the provider send to diagnostic lab and if the insurance denied the payment to the lab, then you might be billed for it in the future. But no one should pay for anything to come in and get tested. No.
We also just got word from public health spokesperson Daniela Carrera that one passenger tested positive on an incoming flight,
Yeah.
and right, and so that's developing. She's going to come on a little bit after 8. Doc, we had another question here. Since sports have opened, they're not wearing masks. The people are not from the same household. Is this public health approved?
No, it's not public health approved. Public health is the guideline for you to wear masks at all time in public. Okay, and again, they cannot control the private residence, but in public, the public health guidelines still you need to use your mask.
And Doc, how long do you think it's going to take? As we got 961 possibly exposed with Tsubaki, 84 staff at Tsubaki also possibly exposed. Then whatever the residual is from the basketball game, Easter gathering, A-class lounge. When are we going to know and have a better idea of what we're truly facing with these 3 clusters?
Yeah, you would know probably about 2-3 weeks from now. So it take about 2-3 weeks for any type of surge to kind of die out if everyone do their part and all the testing and on the contact tracing been done. So it take about 2-3 weeks. So we know what the full impact of this 3 cluster make on the island.
But is the picture going to start becoming more clear? Obviously, it will when we run the public health tests from today, as they're doing that outreach testing, and then run whatever you guys have.
Yeah, it's just very good. The public health, all these people who come in for a drive-through, it's all this is all PCR. It's not antigen test or anything. This is true PCR testing for screening. So this is a gold standard. So they hopefully none of them turn positive.
Right. And so public health testing, Jay, that's 9 to 3 today, right?
Yeah, I think today, tomorrow too. So
Right.
on Saturday also. So again, all the clinic I'm very sure that they will have to step up and also do the testing of the patient come into the clinic. So again, even testing the clinic should be zero charge. They shouldn't pay anything.
Yeah, so today and tomorrow, 9 to 3, Public Health Northern Region Community Health Center, free COVID-19 testing to staff and patrons of A-Class Lounge and the Subaki Tower. Staff and patrons who are at the A-Class Lounge on or after April 7th, and staff and guests who are at the Subaki Tower between April 14th and 18th should monitor for symptoms and get tested. Part of the tricky thing, Doc, is when to get tested, right? Because it's totally possible to be exposed, get tested the next day, and you don't have enough virus in you to trigger an accurate result, right?
Yeah, when you get exposed to some place, so 14, 16, this is probably the right time for you to be tested. Even when you test negative, we're going to ask you to kind of monitor your symptom for another 10 days or so to make sure that you don't have any symptom. If after testing, if you have symptom, then you need to be retested. So testing negative doesn't mean that you drop everything. You still need to monitor your symptom for the next 10 days or so.
Doc, given the clusters that we're now looking at, do you think that any of the protocols we have in place or any of the easing of restrictions need to be re-examined in light of this? Does anything need to be dialed back?
No, Chris. Basically, the restriction don't need to be dialed back. Seriously, I mean, at a certain point, you cannot go back and forth all the time. People have to learn from this, and that's what the government decision and public health decision to do all this stuff to let people understand and learn from it that hey, we're all in the same boat. Please, be responsible. We don't want to go back and do any more restriction because it's been a year already, and our economy need to open up, and people need to be responsible. It's not the government thing; it's the people things. So we all have to be doing the right things. And again, as we have more people vaccinated, the key here is you can have positive in the community, but you got to look at your hospitalization. There's a trigger that will make me worry and make the government worry and the hospital worry is if you have 10 or more people in the hospital, yeah, we have to relook at some guideline again if the hospital get to that point. So you can have positive in the community, but as long as the hospitalization is not overwhelming, then we're doing okay. As the more people get vaccinated, you might see that the cost might go up, but the hospitalization will be very low. And that's what reality is. That when you drop the restriction, you have more people immunized. People tendency to relax more, and they will be more positive. But hopefully, like I say, the hospitalization is down, no one dying. That's what the key. But again, it's all the way down to people. So last week I say, if you're sick, just stay home, don't go to work, get tested, and if you do that, it will prevent this cluster from occurring in the future.
Right. So, Doc, the takeaways here are when you talk about personal behavior, personal responsibility, you're echoing comments that Chimo Bakwem, the acting chief public health officer, just made earlier in the hour on this show. And the reason why they're saying this is because there was a symptomatic individual who played basketball with a group of people that set off this current wave that we're now looking at. There was also, according to Dr. Hoa, Subaki Tower staff who were symptomatic who went to work. Okay. And now because of that, we've got to go and call and contact trace and possibly test and investigate over 1,000 people because 2 people didn't stay home when they were sick. So when we talk about the protocols, and of course, I'm going to ask, are the protocols good enough? Because it's an obvious question. But when we see these two cases of individuals who are sick going around other people, it's clear that that's what triggers this cascade of positives. And now I mean, knocking on wood, and we prayed hard, last night, that this doesn't mean we're going to see a surge similar to what we saw in August, because right now we don't know. Like I said, we're still, would you agree, Doc, that we're still kind of assessing this situation for the next few days?
Yeah, we still gonna assess the situation in the next 2 weeks. uh, they're still gonna get very close. Probably still gonna be working very hard again. Chris reminded the surge from last August or so start with one person getting sick and went to a funeral. They need one.
That's it.
And the difference in August and now is that quite a few of our people on the island have been vaccinated. That's the difference.
Yeah. Doc, we had a question here, a little off topic, but Jan Fegeger writes, how about those who are fully vaccinated since December 30th, 2020? Do they need a booster? I know we've asked you this before, and we are looking at possibly getting a booster, but not yet, right?
No, not yet. You will up to a year, so you have December. As I have mine December, I probably look forward to the next shot, probably December of this year.
Yeah, guys, don't freak out and go and try and get like double vaccinated. Just to, this ain't like a wear two mask kind of thing.
No, but again, the key here is really to just be respectful and if you're not vaccinated yet, go out there and get vaccinated. That's all it is.
Thank you, Doc. And I guess just in closing, so you guys are having the testing at AMC when to when?
We open at 8 o'clock in the morning and close at 6 in Manila. So our testing site at just only in Manila right now, and so just off the whole day. And again, we're gonna try to do our best we can, and you can get tested also at any clinic that's doing the testing. So try to go to somewhere where they have a rapid testing. So it's kind of 10-15 minutes. You will know.
All right. Well, Doc, thank you. Good luck and Godspeed.
Okay, thank you guys, and be safe. Okay.
Was there a meeting last night, by the way?
Yes, we had a meeting last night.
And we covered pretty much everything that was discussed. Oh, let me just ask you last question, Doc. Is this going to affect the plans to ease up on the quarantine, which we were told was going to happen May 1st?
No, it's not going to make any plan on the ease up in the quarantine. It's when you get to 50%, and it's not just a number we come up with. Okay, those are based on study, and I think the study will start at 40% vaccinated. And there's a huge decrease in the hospitalization. And so the number is not, we don't pull out our head. It's based on multiple study that we make decision on. Mm. So I just wanted people to know that those decision is not made locally. We look at a lot of study that other country have, and we kind of, based on the study, we decide to be more conservative and do 50% rather than 40%. So we should be okay. I don't think that the physician advisory group and the governor will change the quarantine guideline goal as we reach 50% of people vaccinated. Right. And we will get there the first week of May.
There you go. Bold statement. Pat the half. We're getting there. Thank you, Doc.
You're welcome. Have a good day, guys.
Good
Be
luck.
safe.
There you go. Dr. Hoa Nguyen, Chair of the Physicians Advisory Group. This is The Link. It's Friday, April 23rd. Janella Carrera, public health spokesperson, coming on to give us just a little more info on, I believe it was a symptomatic patient who tested positive mid-flight.